Assalamualaikum. How are you, Beta? Walaikum salam. Beta, today we will be having uh, class related to context instead of the task. Inshallah, we will make up that class again. In today's class, we will be covering our learning outcome number 3, that is, understand the monitoring and review of health and safety in health and social care workplace. Okay, and we have covered the assessment criteria number 3.1, and today we are proceeding towards assessment criteria number 2.2, that is, analyze the effectiveness of health and safety policies and practices in the workplace in promoting a positive, healthy, and safe culture. Okay. So we will be studying about the policies, the practicality of the rules and regulations in any workplace, and the practicality of promoting the health and safety in any health and safety workplace in a positive and impressive manner. Okay. In order to promote a safe culture, how can we promote a safe culture? How can we promote a healthy culture when we are practicing unhealthy practices in our workplace? Of course, it is not possible. A safe culture, a healthy culture can only be promoted when we are practicing the same policies, the same practices in our workplaces as well. Objective is to make you able to analyze the health and safety policies and practices in, of course, health and safety workplace. Okay, let's have a brief introduction of today's topic. We are actually focusing on creating a positive, healthy, and safe culture in the workplace that is very crucial for the well-being of employees, customers, and overall success of the organization. Let's focus on the effectiveness of health and safety policies and practices in promoting such a culture. Only the health of employees, workers, and even the customers or patients. If it is a hospital, we must include the patients as well. Not only their well-being is necessary, not only their health is necessary, physical health is necessary, but also their mental health is as important as the physical health. Whenever there is a positive environment in any workplace, healthy environment, healthy from every aspect, from health point of view, from physical health point of view, from workload point of view, whenever there is healthy environment, of course the employees will produce much better as compared to the negative environment, the poor environment. Okay. So let us have a look on the effectiveness of health and safety policies and practices in promoting such a culture. Health and safety policies holds the equal importance when we are talking about the success of organization as well, the growth of organization as well, because usually, or you can say actually, are promoting the health through our health and safety workplaces. We are promoting the physical as well as the mental health of the patients as well as employees too. Okay, so we are basically setting up a trend. We are basically promoting a culture that is safe, that is healthy, that is effective. Okay, so how can we implement such culture, or how can we promote such culture? There are a number of various aspects that are equally important. Let us first discuss. Let us discuss the first point, that is support of policies by all level of management. Okay, it means that the management, the first thing that usually comes when we talk about any organization, that usually come in front of any organization, whether it is the time to support the organization, whether it is the time to represent the organization, or whether we are just discussing about the aims, objectives of organization. That is management, administration. Okay, so first step will be, of course, taken up by the management or administration of the organization. The management will play its role in supporting the all kind of procedures, all kind of practices, and the policies that are basically promoting the health and safety in any workplace. Effective health and safety policies require strong support from all levels of management within the organization. This sport is essential for setting a positive example and creating a culture where health and safety are prioritized. Okay, so When we are implementing the health and safety policies, all levels of management, all levels of administration, whether they are the chairpersons or the subordinates or the managers, they need to promote such rules. They need to promote such practices because all these practices are very important to set up a healthy environment in any organization. And all these factors need support from the management or the administration of the organization in order to ensure their smooth setup. Let us have a look on all of them. First is leadership commitment. Assess the level of commitment demonstrated by top management towards health and safety. Analyze their active involvement, provision of resources, and promotion of safety conscious mindset. Leadership commitment. Okay, what is leadership commitment? Of course, here we are talking about the bosses, the chairperson, the chairman of an organization. So this is one of the top level of commitment in any organization. Okay, whenever your CEO, your chairman, your boss actually commits to the implementation of such procedures, it means this is there arises a hope, uh, 90% hope of implementation of these procedures in any organization. And their active involvement is very important. Active involvement of your chairman. Next is communication and engagement. Evaluate how well health and safety policies and practices are communicated throughout the organization. Analyze the effectiveness of mechanisms such as committees, regular meetings, and feedback channels in promoting open dialogue and participation. Communication is very important in every field of business, whether it is a health business, import, export, any other business. In fact, I must say that it is important in any organization. If the workers working in any organization are having a positive kind of positive means of communication or ways of communication, it ensures the proper working of the workers, okay, themselves. So communication is very important for positive communication is very important for the implementation of such policies. And by implementing these policies, we should analyze the effectiveness of mechanisms. Effectiveness of mechanisms or the procedures can only be analyzed through open communications, open talks, regular meetings, and the dialogues between the participants and the CEOs. Okay, so of course, first point is the involvement of the leadership. The second point is the open communication between the leaders and the subordinates. Third is open communication channels and engagement mechanisms further contribute to the policy effectiveness. Safety committees, regular meetings, and feedback channels allow for open dialogue and participation, enabling employees to contribute their insights and perspectives. This involvement fosters a sense of ownership and empowerment among employees, reinforcing a culture where health and safety are valued by all. Okay, so not only the open communication, but also engagement of the procedure will also be analyzed, will also be ensured. First, it is ensured, and then it will be analyzed that everything is going well, everything is functioning well, and through this whole process, okay, through this whole process, again the communication will be carrying on. Communication will be a continuous process through the implementation process, throughout the implementation process. It means that basically the chairman or the CEOs, they are keeping a check on the working of their workers, on the working of their employees. Okay, it is very important because of course when the CEOs will not remain keep in touch with their subordinates, they will not ensure that everything is going well. Okay, so first aspect was support of policies by all levels of management, and now the second is training and compliance of staff throughout the organization. The effectiveness of health and safety policy relies on the training and compliance of staff members at all levels. Adequate training equips employees with the knowledge and skills necessary to identify and mitigate risk. Key aspects to consider include training programs. compliance monitoring, and monitoring and ensuring compliance. Okay, so let us discuss them one by one. Training programs assess the comprehensiveness and effectiveness of health and safety training provided to employees, analyze whether it covers essential topics such as hazard identification, emergency procedures, and proper use of personal protective equipment. Okay, for every kind of policy, for every kind of procedure, we should keep it in mind that the person who are going to implement the procedures, they must be well trained. Okay, they should be trained enough to know every minute detail of the procedure. Okay, so first aspect in this regard, training and compliance is the training program. Okay, so we will analyze we will assess the effectiveness of the training that has been provided to the employees. Okay, as a result of the effectiveness analysis of effectiveness of the training, we will be able to analyze whether our employees are efficient enough to implement the procedures, whether they are efficient enough to install any kind of equipment if required. Okay, for example, the first thing that we notice will whether they are taking care of themselves while implementing the procedures. Are they wearing the PPE, personal protective equipment? Are they wearing the mask, the gloves, the safety costume? In short, the proper safety costume or not? Because these things, the very start, you can say, the things that are basically pioneer in implementing any procedure. These things basically determine whether the workers are efficient enough or not. If a person is not taking care of himself throughout the implementation procedure, it means that of course he is not efficient enough to implement the procedure properly. Next is compliance monitoring. Evaluate the mechanisms in place to monitor and ensure compliance with health and safety policies. This can include regular inspections, audits, and tracking incident reports. Assess the level of accountability and consequences for non-compliance. Okay. Now, after the implementation of the procedures, the next step is the compliance monitoring. All the policies, all the processes, procedures that have been implemented to ensure the health and safety, they will be inspected. They should be inspected regularly. Their audits should be done regularly, tracking the efficiency of the procedure. Okay. So their audit, their inspection is quite important in order to understand whether the function is working, whether the mechanism is going on properly or not. For example, let us take an example of any equipment, for example, aerosols. Aerosols containing, they are known as nebulizers. Okay, if a big nebulizer nebulizing machine. Okay, we are not talking about a small nebulizer or the nebulizer machines that are usually uh, they can be that can be carried from one place to another. Let us assume a fictional nebulizer machine that cannot be carried from one place to another, and it is huge one, and it requires a proper efficient employee to install it. Okay, for example, let us consider we have such kind of industrial nebulizer. Okay, let's name it industrial nebulizer. We have a machine that is industrial nebulizer, and we need a proper efficient person to install it, and they install it. We have ensured that they have installed it properly. Now, how can we know that the machine is working properly in coming 2 to 3 years or in the past 2 years? If we have not used that machine, how can we are sure about its efficiency? Because we have not used the machine, we have just installed the machine 2 years before, and we have not done its inspection, we have not done its audit, although the cleaning and everything has been maintained. But when we will not inspect the machine, we will not audit the machine. If, for example, if it is not in use, even then we will inspect the machine. We will practically use the machine on any patient, or if we don't got any patient who use that industrial nebulizer, we will use the machine as such on no patient. Okay, we can use it on one of the member of audit team or the inspection team. and we will analyze whether it is functioning properly or not. Is there somebody who is keeping a check on the machine? Okay, and usually this audit, these kind of inspection is done by our team outside of the organization, because they are basically analyzing the efficiency of organization. So the team should be outside of the organization that will judge whether the equipments are up to the mark, whether they are updated, whether they are working actually, or it is just documented that we have industrial nebulizer, we have this and this machine, and they are updated, and we are maintaining their cleanliness, and they are in use. Okay. So if a machine is not in use, how we will be sure about its efficiency? For that, of course, regular inspections will be done. Regular audits will be. Assess the level of accountability and consequences for non-compliance. In case if the equipment, the procedures, they are not in compliance with the rules and regulations of the organization, then of course the accountability level will be recorded and penned down in any sort of book or any laptop computer. Monitoring and ensuring compliance with health and safety policies is crucial. Regular inspections, audits, and incident reporting mechanisms help identify areas of non-compliance and provide an opportunity for corrective action. It is important to establish clear expectations for compliance and hold employees accountable for their adherence to health and safety protocols. Okay, so not only the regular inspection is important of machines or the equipment is important, but in case of any incident, in case of any happening, there should be a proper incident reporting mechanism or the that accident or that happening reporting mechanism. Okay, so we actually, when we are setting up any organization, irrespective of what is the niche of organization, what is the area or field of organization, the basic protocols are the same. Every from analysis, from implementation of the procedures, from monitoring, reviewing, and the compliance and non-compliance, everything is the same. So we have to follow all these steps for the proper efficiency of the organizations. Okay, so not only monitor and review, but we will also report the incident if some sort of accident or incident happen in the organization. And it is and in case of non-compliance, the team will also note it down and will send, you can say, notification to the higher authorities of our organization for the non-compliance, for not taking into account the safety protocols. And of course, our administration or management will take the action accordingly. Okay, now comes the third aspect, that is regular review and updating of policies and training. To maintain an effective health and safety culture, policies and training programs need to be regularly reviewed and updated. This ensures that they remain relevant, address emerging risks, and incorporate best practices. Okay, so in order to ensure the effective and safe culture in any organization, in addition to the equipments or the procedures, their rules and regulations will also be reviewed. And if they require, there should be an update regarding the rules and regulations of the organization. Why it is important? Why we need to regularly review and update review and update our rules? Why it is important? Because every phenomena that is in working process, it keeps on changing with each passing day. There will be different challenges, there will be different risks, there will be emerging new practices and new technology for all these processes, for all these phenomena. Okay, so for that reason, they are rules and regulations will change accordingly. So rules and regulations will also need review and update if required. Key aspects to consider include policy review process. Analyze the frequency and effectiveness of the policy review process. Consider whether feedback from employees incident reports, and changes in regulations are considered in the review process or not. Okay. So policy review process, it requires reporting from the employees as well. Okay, not only we will be following the trend, but also we will be taking the reviews from the employees as well, because they are the person who are directly implementing the rules and regulations, who are directly using the equipment, who are maintaining the equipments and the procedures. So we need to take review from them as well. Next is the training program evaluation. Assess the process for evaluating the effectiveness of training programs. Determine whether feedback from employees, post-training assessments, and real-life scenarios are used to assess the impact of training or not. Okay. And of course, for now, for the review and updation of any policy or the procedure, again, the training programs are very important. We will again evaluate whether the training program that had been given to the employees were effective or not. Okay, whether we are sure about that our employees actually are working in accordance and compliance with the rules, and whether they are following the updated rules or not. Okay, and after their training, we will again assess our employees. Okay, we will assess them post training. How we will assess them post training? We will assess them by their working, by their efficiency. When they are implementing the procedures, when they are using the equipments, we will analyze them then. Okay, we will analyze whether they are working in accordance with the rules and regulations or not. Fourth, that is promotion of health and safety at all levels. Promoting health and safety in all levels of organization is crucial for creating a positive culture. This includes fostering a proactive approach, encouraging employee involvement, and integrating health and safety considerations into daily operations. Okay, so health and safety should be promoted in at all levels of any organization, not only at the superior level, but and not only in the, you can say, the least level of administration in any organization, but it should be maintained in all levels and in a positive. This includes fostering a proactive approach, encouraging employee involvement, and integrating health and safety considerations into daily operations. Okay, and for this reason, how can we ensure the implementation or the promotion of health in all levels of management or in all levels of organization? Because we will be involving the employees. Okay, we will be encouraging them. We will be analyzing the health and safety protocols, and we will be keeping a check on every procedure. We will not be actually dependent upon only the external audits or external inspections, but we need to inspect our own procedures at our level. Okay, so we will be actually carrying out the internal inspections as well. The key aspects to consider include proactive risk management. Now, what is proactive risk management? Evaluate the extent to which the organization adopts a proactive approach to identify and addressing potential risks. Analyze whether hazard reporting systems, risk assessments, and safety inspections are in place or not. Okay. So yeah, of course, after we are sure about that, all kind of policies and procedures have been implemented, and the training programs were up to the mark and updated one, and they were quite effective training programs. And now, after the implementation of all such programs, we are done with the external as well as internal audits as well. Now comes the next step. As a result of audit, sometimes as a result of audit, we need our weak areas come over the surface that we were ignoring, or we were not, you can say, overlooking such areas. As a result of these audits, our weak areas, our risks actually come over the surface, and we tend to identify them. We actually, in this case, we will be able to analyze that what are the weakest points, how can we improve these weak areas and how we will increase the efficiency of our organization. Okay, this is known as risk management. After analyzing the risk, after sorting out the risk or any hurdle, how we will assess the risk, how we will manage the risk, this is another important thing to do. Employee involvement, again, employee involvement is as important as it was in implementing the regulations in updating the procedures. Assess the opportunities for employee involvement in health and safety initiatives. Analyze whether the employees are encouraged to provide input, participate in safety committees, and suggest involvement improvements. Okay. So for this step, again, we need to involve our employees. We need to assess that to which level our employees are satisfied with all kinds of procedures. Their the important things, the important you can say the sources that are required for the proper implementation, the sources that are required for the risk assessment. To which extent are employers satisfied with all the sources that have been provided to them? Okay, so we will of course motivate our employees to smoothly do their performance, to do their I can say duty in a positive way. Their motivation is as important as the working of any organization. Conclusion: effective health and safety policies and practices play a critical role in promoting a positive, healthy, and safe culture in the workplace. This analysis has highlighted the importance of support from all levels of management, comprehensive training programs, regular policy and training reviews, and the promotion of health and safety at all levels. By continuously improving these aspects, organizations can create a culture where employees value, customers are well cared for, and overall well-being is prioritized. Okay, so when we are analyzing that health and safety protocols, how health and safety protocols in any organization play an important role in the implementation of safety in any culture, or you can say in the promotion of safe culture. Then, in this regard, we should count all the things that are being implemented, all the procedures that are being implemented in any organization, and which ensure that a safe, healthy environment is present in the organization. When all the organizations are equipped with safe and healthy environment, it of course positively and directly impacts the safe and healthy culture as well. Okay, and for this reason, of course, every person, the whether it is from administration, he is from administration section, whether he is from production department, or whether he is from finance department, or whether he is a physician, or the nurses, or any other healthcare provider who is working efficiently in the organization. Okay, all of them play equally important role in from implementation of the procedure. No, from the idea generation to the implementation of the procedure, risk assessment, audits, and finally the result, the output, that is safe success. Okay. So every person holds equal importance, and we need to ensure that health and safety protocols have been ensured at all levels of organization. And because when the workers are healthy, when the healthcare providers are healthy, when the administration people are healthy, of course they will be able to work much well. They will be able to take care of others' health as well, their colleagues or the patients. Okay, so everything go hand in hand. When the workers are healthy, they will ensure the efficient work. They will ensure the health of their colleagues. They will ensure the health of the patient. Okay, so everything needs to be updated, needs to be managed accordingly. Okay, so with our learning outcome of today's class was understand the monitoring and review of health and safety, health and social care workplace. Okay, so it means that we are not talking about just the hospitals, but we are also talking about any organization in which the health and safety protocols should be considered or should be kept in mind. Okay, so Which tell me, is everything clear to you up till now? Or do you have any kind of question, any kind of confusion? Please ask. Okay, all right. Vivek, I hope so. Everything will be clear to you. Okay, can you tell me what is monitoring and what is review? Monitoring and review. Yes, exactly. Okay, monitor means we are actually analyzing our procedure or any kind of can say policy, and review means that after the monitoring we are reviewing our procedures again. What on the basis of the results of monitoring we are basically reviewing our procedures or the policies, or you can say any equipment as well. Okay, this is all for today's class, beta. I hope so it is clear to you. And if you have still any question, you can ask Ms. Simra, and then of course I will be replying. So next class, we will be covering our context, complete syllabus of the subject, and then the two tasks class will be left behind. So I hope to cover them all this month.